A story we have been following throughout the day. You're looking live once again at Atlanta's Hartsfield-Jackson International Airport, where earlier today, a flight carrying a number of Americans who were on that cruise ship where people were exposed to the hantavirus were flown back to the United States. Two people who were on that flight deplaned at Hartsfield-Jackson and made their way in what can only really be described as a medical transport, almost a medical convoy, over to a specialized unit at Emory University to be observed and to be treated as necessary for hantavirus. It's kind of a novel situation playing out today. We're joined right now by Grace King. Grace, you have been following this all day long. Bring us up to speed. 18 Americans, or I should say 17 Americans and one individual with dual citizenship in Great Britain and the United States were flown back to the United States today. Two of them are now here in Atlanta. The other 16 are in Nebraska. What do we know about this situation as we stand right now at almost 3:10 in the afternoon?
Well, right now, public health officials are just kind of in this wait and see mode to see who actually has the virus, who has symptoms, who could exhibit symptoms. They said it takes up to 42 days from their first contact. That's the longest incubation period the hantavirus can have. So they're working to figure out, it's going to be a very individualized approach, person to person. 42 days from the last time they were exposed to the virus. They don't know when that is yet. So for some people, they might have last come in contact with someone with the virus, 3 weeks ago versus 2 weeks. They're trying to work and figure out when that 42-day time frame is. Some of the passengers have symptoms. That's how the couple ended up here in Atlanta. They said the only national quarantine facility is in Nebraska, so that's where they took the majority of the passengers. But once they have symptoms, they move into something called a biocontainment unit, and that has specialized systems so that the air isn't going into other units or other rooms. The waste is being treated separately and disposed of properly. So these biocontainment units have this really specialized technology to contain everything in there, and that has more limited capacity. So there was a couple on board the ship that was American. One of them was already exhibiting symptoms. They do not yet know whether that person has the hantavirus, but they said, you know what, let's take this couple because they have been in such close contact with each other. Let's send them to Atlanta. Atlanta is one of the 13 specialized regional pathogen facilities that has those specialized biocontainment units. So they brought them here where they can get, world-class care at Emory. Emory obviously handled Ebola back in 2014 with these specialized biocontainment units. They're no stranger to deadly infectious diseases, so they're ready to treat this if that is that. Again, one has symptoms, the other doesn't. They don't know yet. But they said, let's just break off this couple so that the Nebraska facility won't be overburdened. They don't want it to develop into something and then say, well, we have room for 10 people here, but all 16 have symptoms. So they figured, let's just split them off to Atlanta early.
And we should point out as well, earlier, if you've been watching us for the last hour or so, we spoke with Dr. Cecil Bennett, who pointed out what many medical professionals have said, which is that the general risk to the public is quite low when it comes to a disease like hantavirus. The number of Americans who are now back in the States who may have been exposed, but nonetheless, a specialized and focused response from public health officials to this group of about 18 folks who could be at risk right now after their time on that cruise ship. Grace, you pointed out it could be 42 days of incubation before people could start to see symptoms. These folks already had to spend a bit of time on the cruise ship that seems to be sort of the originating point of this outbreak. Will people have to stay either at Emory or the National Quarantine Center in Nebraska for the full 42 days before they can get cleared out? And that is still early. This may not be a question we know an answer to.
It's all going to be on the individual assessment of when their last contact is. They said a lot of this is hantavirus is extremely deadly if you do have it. It's kind of like a 50-50 survival rate almost. So they're saying it depends on where do you live. If you go back and you suddenly develop symptoms, do you have access to medical treatment that would not involve you then having to travel to get this world-class care? That high intervention is so important. There isn't a miracle drug, so to speak, for hantavirus. It's mainly just specialized IV fluids and breathing machines, different things. So where you live in relation to what kind of healthcare you have near you is one of those big factors for that individualized decision making. So, if you were here, say, in Atlanta, right by Emory, you would have a lower risk going home, quarantining there. If you developed it, you could drive down the street to Emory. You're already there. If you live, maybe somewhere up in the mountains, it's just harder to get that high class healthcare. So they said it's really going to be passenger to passenger. What was your exposure? How likely is it that you have it? If something were to happen, what help can you get? How do we approach this? And I mean, it's up to them. If they feel more safe quarantining in Nebraska for the next 42 days or whatever remaining portion of that is, they're welcome to stay there. They described it as kind of like a hotel type situation. You know, they have different things you can do there. It's not like you're just in a doctor's room locked up, but they just have that monitoring and testing. And they also said this isn't like COVID. COVID was a really new disease that they had to learn a lot about the transmission, the risks, and how it spreads. This is something that's been around for a while. It's rare, so you don't see a ton of cases of it, but they know, generally speaking, how it transmits, what the risks are, how the symptoms manifest. So it's something that they have a lot of research for, so they're less worried about it in that sense because they do have all of this history with it.
All right, Grace King, we know you're going to stay on top of this, perhaps for 42 days or longer, as we continue to monitor this novel situation involving a hantavirus outbreak on a cruise ship.